So I grew up in the Acres Homes community, and it's one of the communities here in Houston that is historically underserved. And so I was surrounded by people who actually didn't have access to high quality care. And so for me, that's always spurred me as I thought about my career and how I wanted to engage in medicine, not just in a clinical setting, but also thinking more broadly at the population level, what things we could do to really improve the health of communities.
Additionally, for the University of Houston and the center that Humana has established on the campuses, what's been great is the curriculum that they're creating. And that means not just in terms of the academics, it also means like what's going on in the community as well.
Right now, I feel like we're still building the foundation to connect the dots between research, policy, and operation. This opportunity to tie social data with medical data, I think, is the next frontier in healthcare delivery.
A great example of how we're able to use data is our PAPA program. So we were able to take data that Humana collects on its members and identify community dwelling seniors here in Houston who were experiencing loneliness. And we were able to take those individuals and connect them with students here from our Graduate College of Social Work.
I'm very thankful to the PAPA program for allowing the opportunity for virtual visits. It essentially became like a caseload of grandparents because they would look forward to me calling and I would keep in touch with them. So that was very nice.
Being able to pair up social work students with seniors, I think, has been a great way that the Institute has addressed the COVID pandemic.
COVID-19 has certainly presented many challenges, but we at the Institute have approached COVID-19 as an opportunity to think about ways that we can further leverage the relationship that exists between Humana and the University of Houston to meet the needs of our students and also to meet the needs of our community.
There's a shared vision and there's a shared mission. So that being said, it's easy to say, how can we produce more nurses? How can we produce more nurses who understand what it's like to work in the home? How do we come together for clinical experiences that really make a difference in our cutting edge? The first key area is with the telehealth experience. One of our students told me that she spent 2 hours on the phone with a Humana member, making sure the member had what they needed. That's awesome. They also are telling me, we love being part of this rotation because we're seeing continuity of care. And Humana has been instrumental in helping craft these new clinical experiences.
The virtual experience has actually been a really good one for me, and I think that there's been a lot of support from both the school and Humana in terms of propelling my learning. So Humana is really big on integrated care, and that's a theme that I've seen through all the pharmacists I've met. I think at this point I've met up to 30 different pharmacists in various sectors of Humana.
When they come, they're going to realize how value-based care is unique, and because in taking care of the patient holistically, we actually help to decrease costs consistently.
Humana is one of the first organizations, at least to my knowledge, that's actually going forward with both this integrated care and value-based care. The reason behind why I want to pursue healthcare has definitely evolved. I've realized exactly how important health equity is.
What's important about what Humana is doing is they're not just focusing on the clinical setting, which is important, and that needs to continue to be strengthened and augmented, but they're also focusing on the community, which is where health is actually at, and that's where health is going to be affected and where the largest return on investment is going to occur.
So with Humana being in the community and working with the University of Houston College of Medicine to be a face on the ground that is helping to fix barriers like access to medicine, access to insurance, access to quality care, is part of the solution that these communities, underserved communities, need in order to move forward and eliminate health disparities.
These are things that makes the community realize, oh well, it's actually not just a photo op. It's there's people that are probably genuinely interested in our health and well-being.
Our class of 30 is learning the solutions to go out and affect change in the society. Joining forces is not only the right thing to do, but the best thing to do in order to reach our mission.